So we don't need to lock down entire countries. It's a huge mistake. So says our next guest. I wish we had booked him 2 months ago before we shut down the entire country. Dr. Paul Saladino, a physician in private practice in California. He is the author of the new book, The Carnivore Code. More on that in a moment. But first, doctor, welcome. You really think we blew it? This was all a mistake, an overreaction?
I do, sadly. And at this point, it's water under the bridge. But if we look back at the lockdown efforts and can decide that they were a big mistake, it helps us feel a little bit better about encouraging places to open up the lockdowns moving forward, and we can all get back to our lives.
So I've heard Sweden. Sweden basically didn't lock down. I think we have some footage of people still walking around, still going to cafes. This is in the past few weeks, this footage. All the stuff stayed open. Old people, elderly people with underlying conditions stayed home. I've heard varying interpretations. How did this work out for them, according to you?
It worked out for them pretty darn well. And it's so interesting to look at the way the different news media outlets will represent the exact same objective data in Sweden. But if you look at the Sweden death rates per capita, they're essentially in the middle of the pack in Europe. They're not catastrophically worse than other places in Europe, and they're better than many states in the United States. And we see this across many other countries, like even Belarus, that didn't do any real formal lockdown measures. And we can draw a real distinction between social distancing, which is pretty easy to do and doesn't have a whole lot of risks associated with it, economic risks, social risks, isolation risks, and complete lockdowns, which, as we know, are economically catastrophic. And Sweden took this nuanced approach where they said to their citizens, hey, be careful when you're walking around, maybe use a mask, don't cough on your grandparents, but we're not going to stop the whole country from moving economically. And things did not go up in a blaze of unfortunate infections and deaths. Their rates of infections and their rates of ICU usage are declining. Their rates of death are declining in much the same way that we see the patterns all throughout Western Europe. So from my perspective, Sweden is a total success. And we see this mirrored in many other countries that similarly were, I would say, astute enough to avoid strict lockdowns, but maybe just to employ more nuanced social distancing, which is much easier.
So, doctor, interesting. All right, but we're not in charge of opening up or closing down countries. In the meantime, though, you've got some advice for folks in terms of diet, and I actually want to start with vitamin D. That comes from the sun, right?
Vitamin D comes from the sun. Now, there have been some incredibly intriguing studies coming out in the last few weeks in the United States, India, Indonesia, and the Philippines with regard to vitamin D levels in the blood and the severity of COVID-19 outcomes. And what's very clear is that in those people with robust vitamin D levels, specifically greater than 30 nanograms per deciliter in the blood, the rate of COVID severe outcomes is 10 times less, meaning that if you have a decent amount of vitamin D in your blood, you're much less likely to have a severe outcome with the complications of coronavirus. And the tricky part of this is that this doesn't just mean that we can take vitamin D. It's epidemiology research, so it's associational. And what it really means is we should probably be getting real vitamin D from the sun. And it also gives us indications about underlying metabolic health, which is what I'm really interested and excited about sharing with people in the midst of this coronavirus epidemic, because similarly, what we're finding in very clear terms is that those people with metabolic dysfunction, insulin resistance, or essentially pre-diabetes and diabetes are also at a much greater risk of severe coronavirus complications. But is this being talked about in the mainstream media? Not really.
All right,
and
doctor.
That's what's very unfortunate.
Well, we'll talk about it a little bit more in a couple of minutes. Stay where you are. I want you to give us a 30-second, if you would, summary of this metabolic approach you're talking about. It's in the Carnivore Code. Stand by, if you will. I want to bring in Dr. David Samadi, who I sense has also been critical about the mass shutdowns and lockdowns that we've been engaged in. But first, Dr. Samadi, some interesting news out of South Korea. My understanding is once you get the infection, once you get the COVID infection and you recover, you might be more resistant than we previously thought.
That's correct, Greg. And this is a very important segment. You've heard a lot about panic and fear of being reinfected. A lot of people thought that, if they've had the virus and if they go out again, they can get this. And this study coming out of South Korea, looking at hundreds of patients, is telling us that if you already have had it once, even if your test turns out to be positive after you recovered from all the symptoms, you're not going to be infectious and you're not going to be able to pass this virus to other people. So why is the test positive if you already have recovered from this? And the study shows that this particular test is looking at certain fragments or RNAs of the virus. These fragments of the virus can stay in your system for a while, but those are dead viruses, and you're not going to be able to be passing on the infection to other people. This is very, very important when it comes to opening our economy and being able to get a lot of people back to work. We need to pay attention to their symptoms. Now, when it comes to antibody tests, I want people to know that there are two types, IgM and IgG. And IgG is the one that means that you have had this virus for a longer period, and that's more protective. What level it should be, we're not quite there yet. But a lot of good news in this crisis coming to you. And I totally agree with the doctor that there's a major difference between social distancing and locking down the entire country. And he really described it very well. And we could have done this social distancing just like many other countries without letting our country go down or the economy to be affected. So a lot of great news.
We'll have to remember that for the next pandemic. Let's hope that's not for another century or so. Okay, gentlemen?
I hope so, too.
All right, very good. Very quickly, if you don't mind, Dr. Samadi, hydroxychloroquine, the mainstream media went crazy when they found out the president was taking it. Your advice as a physician to anyone watching who's tempted to ask their own physician about this?
We wrote a great article about this. At the end of the day, it comes to the risk and benefit of this medication. It's individualized care. It's a discussion with your doctor. If the benefit outweighs the risk, it absolutely is a very good treatment. I applaud the doctors in the White House and President Trump to having that personalized discussion. He's not encouraging people to go out and get this prescription automatically. He's basically preventing and his prophylaxis from getting to a hot zone and getting close to the ventilators. The UK president got into trouble. His best friend passed away from this. So what's good for him is what he's doing. But talk to your doctor and find out what your risk and benefits are.
Dr. Saladino, we know obesity is an underlying, can make you more susceptible to COVID. I'm not kidding. I know myself and a lot of other people during this lockdown have gained weight, significant amounts of weight. Your new book, which came out just prior to COVID, the Carnivore Code, is that like an updated Atkins diet?
In some ways it is. The idea is that animal foods have been incorrectly vilified for the last 3 decades, that we're looking at bad science and bad epidemiology that's been misinterpreted when we're hearing all of this media rhetoric that animal foods and animal meat is bad for us. And in fact, these foods are the most bioavailable sources of all of the nutrients that we know are necessary for a healthy immune system. So it couldn't be more relevant than it is now. And the flip side of the equation that I talk about in the book is that some plants have toxins and can harm humans. And yeah, it's all in there. And with regard to hydroxychloroquine, I'll just mention that I actually tweeted to the president this morning. I don't know if he'll respond to my tweet, but I said, improving your diet and your metabolic health will be more protective than hydroxychloroquine. Boris Johnson, the Prime Minister of Britain, certainly ended up with a pretty severe case of coronavirus. But as we know, he was metabolically unwell as well. So he had obesity. He almost certainly had insulin resistance.
I didn't know that. I knew he had a sloppy head of hair, but I never, I know really, I didn't know that. But look, I think it's very serious, this Carnivore Code. And you're right. Maybe the president wants to look at it. I definitely want to lose some weight. I certainly put on some metabolic conditioning will help. Thank you very, very much, Dr. Saladino, Dr. Samadi. Take care, okay?
Thank you.
Thank you.
And one more time, the Carnivore Code looks good. This could be big.